All right. So we're going to start this off. I want to welcome you for joining with us. We have Mr. It's Oba Femi, right? But you go by Femi?
Yeah, I go by Doctor. Actually,
Right?
Dr. Femi. Actually, I go by
Dr.
Dr.
Femi. Okay, Dr. Femi Akinsanya, right? Akinsanya.
Yes.
And we're going to just get to know him a little bit better and going to have a little information on what he felt like starting up his private practice and just kind of learning his journey here on the series for today. So let's start by getting to know you better. Tell us a little bit about yourself, your practice, where you're located, and what services that you offer.
Okay. My name is Dr. Femi Akinsanya. I am actually I'm a pharmacist by profession, and I'm also a psychiatric nurse practitioner. I am located in Fishers, Indiana. The name of my practice is Dynamic Healthcare Solutions LLC in Fishers, and I've had this practice now for about a year.
That's already been a year.
Yeah.
It's been
Yeah.
a wild and crazy ride, I bet.
Oh yeah, it's been amazing. It's been an amazing ride. It's been up and
Awesome.
down, but so far it's been up more than down. So
Yeah, stressful though. It's a little stressful
oh,
starting all of that.
oh
Um,
yeah, definitely.
so what inspired you to start your own private practice?
Um, I I was actually I had a job before, but I got tired of it. I got tired of like trying to ask for like vacation hours.
Mm.
Um, I got tired of just the rat race of just the 9 to 5. I wanted my own practice. I wanted something, that I can just do at my own leisure at any time I want. I mean, right now my practice, I wake up anytime and I I have it from Monday to actually Monday to Sunday. So, but the thing is, I work whenever I want to work. It's not like I have to be there. So that's what
Right.
I wanted. I wanted something that I can control.
Yeah, that flexibility is awesome to be able to, I'm going to work this day, or I'm going to take a week off because I'm going to go on vacation and I have to ask anybody for time off and possibly getting told no. Or if you're sick, you
Exactly.
just can't go in, you just can't go in and you don't have to,
Exactly.
you can get all that taken care of. So
Exactly.
if you had to go back in time, what advice would you give to yourself a year ago about starting your private practice? What have you learned over the last year that you wish you kind of would have known before you started your practice?
Over the past year, I think if I could go back in time, I would just tell myself just to be patient. You don't build Rome in a day. It
For
takes
sure.
time. It takes time for you to have, yeah, it takes time for you to have clients. And it takes time, just like the whole building, the whole practice. It takes time, the patients, the community they have to get to know you better. They have to know your practice. And then once they start knowing your practice, then you just it's gonna be like an avalanche. You'll just patients will just start coming from nowhere.
Right. And that snowball happens. They have to kind of form that trust with you, that you're not just a
Exactly.
temporary guy, and they start hearing back from their patients how great you
Ex-
are. Then they just start
ex-
sending, more patients with you. But yeah, you're right. I think some providers get, they think as soon as they open up the doors and have a website that boom, all these patients are going to come rolling in the doors. And that's not what it is at all. Unless you have patients that are following you from somewhere, then maybe that may be a little faster. But in the beginning, if you're
yeah,
brand new out there, it takes some time and to have
exactly.
patience and building that up and building your marketing and all that kind of stuff up. So yeah, I agree with you. It does
Exactly.
take time. Um,
Exactly.
so starting any business, right, has its challenges. What were some of the biggest challenges for you when you faced starting your practice outside of the being patient part? What would you say the biggest challenge?
The biggest challenges for me initially starting was just building up my patient load.
Mm-hmm.
Getting my website out there, getting my business. You people don't know you, so you have to market. You have to market. You have to spread the word around. You have to go to various offices like therapists. Various business meetings. You have to make sure they know you. So that was a little bit challenging because you have to let the community know you, let them know your practice. And once they start knowing you, then it starts picking up.
And that can be scary too, having to go into people's offices that you don't know. For some
Exactly.
people are more extroverted than others. For me, that would be terrifying to go in and talk to people that I don't know and giving them my business
Exactly.
card and just trying to form that relationship with them. But other people, it comes naturally to, right? So I think that networking, I used to tell people that it's no different than, selling candy bars for school or selling Tupperware, Mary Kay, whatever back in the day. That if you don't open your
Exactly.
mouth and tell people about your business and be excited about
Yeah.
your business, they don't even know you exist,
Exactly.
and
Exactly.
just talking to people. So as far as like financial planning advice, that's vital for any practice, having that, financial planning in the background. What would someone need to know about the financial side of starting your private practice? Did you have savings? Did you work part-time while you were building things? Are you still working? Like, what did that look like for you? What kind of financial planning did you do?
Yeah, so starting out, I knew this is what I wanted to do. I mean, from day one, once I got my license, I knew eventually this is what I was gonna do. So I saved up a little bit so I could start from scratch, and that way I don't have to rely on going back to a job. I mean, currently I work, but I just work like just minimally. I work right now. I work about 10 hours a week. Because I
Mhm.
mean, my practice right now, I mean, I'm totally focused on the patients I have. So during the day, I just focus on the patients, and then I just work like about 10 hours, 10 hours per week. But that has really helped me because I was able to like save up
Mhm.
primarily like before I started. So I was able to save up, and then that way, I was able to like just jump in and just tackle the business. So I would definitely, if someone is trying to get into the business, I would definitely just say just save up a little bit, and then from there you can really, you can start, you know.
What would you
Yeah.
say a ballpark? You don't have to tell me exactly what you spent, okay, or what you
Okay.
saved up, but give me a ballpark figure. If someone's like, well, how much should I save up? What would be your
Okay.
good ballpark figure for them?
For me, I saved up about between 10 to 20,000.
Okay. Yeah.
That was, yeah. Yeah. In between that, I think in between that amount it's good. So
Okay.
between, yeah. Yeah.
Give you a little cushion there. That's a good idea. I've
Exactly.
had other providers tell me, I worked full time and then just put some money back. I worked overtime shifts and put that money back. Just kind
Yeah.
of juggle those things. Some people have different relationship things, like maybe their husband or wife can handle things while they dig into the private practice. But I
Hmm.
think the biggest thing is to have a plan, right? Don't just quit your job and then
Yeah.
think that you're going to have
Hmm.
patients, full patient load tomorrow. That's going to take the place of that. You really have to do some planning and do the numbers. I get
Exactly.
asked all the time in the Facebook group, like, how many patients should I have before I quit my full-time job? It's like, I don't know. What's your financial status like? Do you have a bunch of
Yeah.
money in the bank? You could quit tomorrow. Or are you having to work to pay the bills and barely making ends meet, and you're gonna have to save some,
Exactly.
or do you have a bunch of credit cards? I mean, I'm just can you take a second loan out on the house? There's a lot of things that
Exactly.
everybody's financial situation is a little bit different.
Exactly.
Um,
And it's always good to have like a short-term goal, long-term goal, so you can,
right.
you can fix, it's like you said, planning is the key. Everything is planning. Yeah. So
Yeah.
definitely.
Yeah, the goals, you mentioned that. That's very important too. People have,
Mhm.
where do you want to be in a year from now? Where do you want to be
Mhm.
5 years from now? Where do you want to be 10 years from now? And I know some
Exactly.
people get so stuck in, well, but I'm just worrying about getting my private practice started. I can't even imagine what it's going to be like in 5 years or 10 years. But it's a good idea to know what those things are, because I know me, as I get older, time passes very, very fast, right? And if you
Exactly.
don't have that in front of you, constantly keeping your eyes on the prize, so to speak,
Hmm.
that 5 years passes and you're like, oh my gosh, I'm still doing the same thing I was doing when I very first started. So having that goal of where do you want to be in 5 or 10 years, I think is very important, and keep it in front of you so that you're revisiting that. Um,
Exactly.
and then
Exactly.
also budgeting too, and knowing, like, maybe you're renting an office space at this point. but maybe at some point you want to buy real estate to have the office in, because that's a business building opportunity, right? Maybe you want to rent rooms out to other people. Just kind of have those steps, right, in mind, because you're an entrepreneur. You started your own practice, so you're learning how to ways to make money and grow and, you know, kind of scale your business, and those are things you have to think about too.
Exactly. Definitely.
So let's see. The next thing would be, what advice would you give to someone considering starting their own private practice? If you're just talking to somebody, if I was a nurse practitioner and you were telling me, you know, about starting my private practice, what advice would you give me other than what we've talked about before?
Okay. What advice? I think the advice I would give to a person that just wants to start out, you know, I would tell them, be patient, you know. I'll tell them be patient. It doesn't happen overnight. Sometimes you might get frustrated with the whole process. Just keep at it. I mean, eventually, you know, eventually you're gonna have success. So just strive to just keep doing it. Eventually you'll definitely, you know, break through. That's really like the big thing I would say. I mean, hard work pays off. So just keep doing what you're doing. Yeah, it will definitely pay off. Yeah.
And so, yeah, the frustration in there. I know that comes out a lot when we're dealing with providers. They get frustrated. Things aren't happening as fast as they want them to happen, or there's just so many things to do, right? So when you were getting everything set up, I'm sure you probably felt like, man, there's a lot of decisions to make. All this stuff is coming at me really fast. And did you ever want to quit? Did you ever like, oh my gosh, maybe I'm doing the wrong thing? Did you ever feel like that?
Oh no, for me, I knew this is what I wanted to do. I've always wanted to be an entrepreneur. So even since when I was little, I've always wanted to have my own practice. You know,
That's
this
awesome.
this is what I want to do. So nothing can stop me. So
awesome. I like to hear that.
Yeah,
it's
that's
hard
my
though.
mindset.
Like, yeah, it's hard. You get that little voice in the back of your head that like, are you sure? Are you sure you're doing the right thing? This is hard. You know, sometimes people give into that, right? It's easier to go, oh, this is hard. This is hard. I don't want to do it. It's outside my comfort zone, because you're not taught this stuff in school, right? So you're really that step to step outside your comfort zone and do something different, and then trust others to help you, right? To do those things. And so it can really, you feel like you're kind of walking on ice. You're not sure. You're like, I think I'm doing the right thing, but am I? What am I doing? You know, what am I supposed to be doing? It's really easy to, you know, back out, I guess you could say too. You know, I've had providers tell me that, gosh, it was really scary to even make the first step to go get the business started. And then all of the other things that came behind it, I wasn't sure if I was doing the right thing. So it's great that you felt like you're doing the right thing. So has there been, since you started your practice, has there been any memorable patient stories that have impacted you that, you know, that made you really feel good about going into your private practice? Of course, not, you know, saying any names or anything, but has there been anything that you're like, wow, I'm really glad I did this? And there hasn't been, that's fine too. But if there's anything that can just stands out where you're like, man, I did the right thing by opening my practice. Can you think of any situations that you had like that?
Just pretty much I think it's like the patients that I help, they're really appreciative. And me seeing the patients, like, you know, once I schedule the follow-up, me seeing them go through with the follow-up, I see them month after month. So I have my own patient load. I have patients that, you know, that trust in me, and then they like me as a provider, and then they actually refer their friends and family. That's what really, you know, makes me really like fulfilled, you know, and happy. I know I'm doing the right thing. I mean, once, especially like once I see a patient and I'll ask them the first question, I'll be like, okay, so how did you find out about us? And then they'll just tell me, oh, my friend, you know, referred me, or my therapist. I was like, wow, that's really, really great.
Like, yes.
You know? Yeah, exactly.
Exactly. That's when you know you're doing something right. When people are referring their friends and family because they trust you. And things. So, yeah, that's super, super important. And it kind of feels like a snowball. Before you know it, you're seeing the whole family, you know, and everything. And then the therapist and other providers that are sending patients to you too. That's awesome, right? They're starting to trust you. One I recommend sometimes is people send like a thank you note to those providers and say, thank you so much. for, supporting
Exactly.
my private practice. And I think
Exactly.
handwritten notes go a long way nowadays because nobody does that anymore, right? So when they get a
Yeah.
little letter in the mail from you that says, "Thank you so much, I appreciate it, blah, blah, blah," that really kind of hits
Exactly.
home with them and they send you more people, right?
Oh yeah, oh yeah, definitely. I even have like insurance companies refer patients to me.
Yeah.
So yeah, once they get to know you, I mean, they know that you're doing a great job. They'll send people your way. Yeah,
Yeah.
that's
That's not
how.
a bad
Yeah,
problem to have, right?
exactly,
So
exactly.
one thing since you started your private practice, is there anything that you do to stay updated on the latest trends and advancements? Because now you're not at a hospital or at, a private practice that's pushing you to do all this stuff. Is there something that you do personally to keep that going for yourself so that you can stay abreast of all those things in your private practice?
I do a lot of research. So I definitely keep up. I go on the computer. I do a lot of research, find out like the latest trends, the latest. I do a lot of research, and then I have like pharmaceutical companies that reach out to me, and I actually did I had a seminar yesterday. Well, not a seminar, like a meeting, like a pharmaceutical meeting.
Mm-hmm.
They provided lunch, and then they talked about their medication. So I have about like 5 or 6 companies that I normally meet during the month, and
Mm-hmm.
where they provide lunch. We talk about medications and stuff like that. And then you know my goal is to eventually like travel out of state, for different like seminars and stuff. So
Okay.
that's eventually that's my goal. Yeah.
That's a business write-off too, right? Because,
Oh yeah.
it's your business. So you have that. Do you have any favorite like websites or anything that you go to that you could share with anybody else that might be looking for that type of resource information?
For the information.
Got any places that you go, subscriptions that you may have that may help someone else?
Yeah, I have the American Nurses Association. They
Mhm.
have some places on there that they have like places on there, like they even have like some seminars that you can go to. They
Mhm.
have some research information. They tell you about different things. Um, I also go to um let me see. Well, because I'm a pharmacist as well, so I go to like
Right,
different
right. I forgot about that. Yeah,
pharmacy websites.
yeah.
Yeah,
So you have,
so
but
I
that's
have
good though
different
too,
pharmacy
because
organizations.
yeah, that's good too, though, because you have that
Yeah,
pharmacy knowledge. I think when I was in nursing school, pharmacology was
exactly.
like, and I didn't even go to nurse practitioner school. So to have a provider that really has that background in
Yeah.
pharmacy is going to be awesome too, because you know all of the good pharmacy stuff. Um,
Oh, yeah.
so where do you see the future of
Exactly.
healthcare headed? Like, where do you see it headed? And how is your practice preparing for that? You think it's going to get better? You think it's going to get worse? Like,
Um,
what's your thoughts on mental health care?
well, mental health care, I really think it's gonna go for the better. In the future, I think, especially like mental health, I think telehealth it's gonna shoot up. That's like one of the big ways,
Yeah.
patients can see providers. Because even in my state of Indiana, even before I started, there's a long list of wait, like patients. Some patients wait 3 months just to see a mental health provider. But telehealth is like connecting the provider to the patient. Even like, the provider to the patient might be like 2 hours away. But telehealth, you can see the patient right there. You can order the medications right there. It's so convenient. And I really
Mhm.
see telehealth being the number one, avenue for the patient to for I see telehealth as being the number one avenue for the practitioner to see the
Yeah,
patient.
I do too. If just our government agencies get on board, right?
Exactly.
EPA
Exactly.
and Medicare, they just all would just join together and things better.
Exactly. Exactly.
How did you use technology in your private practice to improve your patient care? What kind of technology type of things have you used that you really think have benefited you in your practice?
What kind of technology?
Yeah.
I use I mean, thanks to Silverleaf, I used thanks to Silverleaf, they got me connected with IntakeQ. I
Hmm.
love IntakeQ. It's very like user friendly. I also use Zoom. to connect with the patients. I use Zoom to connect with the patients, but pretty much just intake queue, Zoom. I order my meds through intake queue. It's just really like user friendly and very efficient.
Okay.
So pretty much that's pretty much all I do. Yeah.
How would so you mentioned Silverleaf. So how all did Silverleaf help you on your journey to set up your private practice? What kind of services did you get from us? How did you feel about those? Completely honest, like tell us if they're pros, cons, whatever you'd like to tell anybody else about our services and how we got you set up with everything.
Okay, well, even before my sister actually told me about Silverleaf because she actually uses Silverleaf, and I always knew in the back of my head I wanted to be an entrepreneur. I wanted to start a practice, but I didn't know where to start. I didn't know how to do it. But but linking up with Silverleaf, they just made the process really seamless. It was like I was like, wow. Just like the first month, I had my website. I was communicating with the website developer just constantly. Website. Then they hooked me up with the EHR. Even right now, I'm doing some marketing with Silverleaf. Everything is just so seamless, and I was like, "Wow, is it this simple?" I was shocked, really. I was scared. I was
It's
like,
not
"Is
that
it this?"
simple.
I know. I was like, "Is it this simple?" Yeah. So
Yeah.
because I find that a lot of providers sometimes they don't know where to turn to. They definitely don't know where to turn to. But I feel like if they knew that there's a place like Silver Lake that has everything in a bundle that can just help you like that, I feel like there'll be more providers doing what I'm doing.
Yeah, then that's what we're here for, right? We want to encourage and empower not only nurse practitioners, other providers too. But we've had therapists reach out with us. I had a lactation consultant who's also a nurse that reached out to us. So we really want to empower those folks to get into private practice and help people. Psychiatry and nurse practitioners have always been, that's where we started, right? But we branched out a little bit. But our goal is to empower you guys to get out there.
Exactly.
My story with that was helping my friend set up his private practice. He didn't know where to start. And I was like, I don't either. We'll figure it out. Right. And he said, just tell me when to start show up and start seeing patients. I was like, oh, so luckily, I was able to build his website and get his EHR up and stuff like that. But I realized then that there's not a whole lot of help out there. You can go to the places that will help physicians, but they charge you a crazy amount of money.
Exactly.
And they're more physician geared. They're not nurse practitioner geared. So
exactly.
We want you guys to be successful, right? That's what keeps us in business too. But it's nice to hear the stories from people like you, right? That, hey, it was great. Everything's going great. My business is going great. That makes us feel like we really are doing what we set out to do. So that's awesome.
Exactly. And even like right now, I'm still using Silverleaf. I'm using Silverleaf for like the VMR, which is virtual medical assistant. Yeah, I'm using Silverleaf for that. Even for the billing as well, I'm using Silverleaf for bill. So it's like, Silverleaf pretty much they have all the tools that you need. We
did your logo. Awesome. We did your logo too, right? We did a logo.
Oh, yeah, the logo.
Your website, logo. Marketing, EHR,
everything.
Spruce? You did Spruce too, right?
Spruce, so, I do. So yep.
Everything.
Pretty much everything. Yeah.
It's hard for me to keep up sometimes with what everybody uses. Not everyone gets everything, right? They may do pieces and pieces. So
exactly.
So I know you're busy, and I thank you so much for getting on here with me and sharing your story and your insights and everything today. That's very, very helpful. And
no problem.
Yeah, awesome. And we thank our viewers and stuff for turning to Silverleaf Spotlight series from the field, and stay tuned for more inspiring stories like Akinsaya is here. And until next time, thanks.
Oh, Dr. Yeah, no problem. Thank you so much. Thank you for having me. Thank you. Bye bye.
Yeah, you're very welcome. Take care. Bye bye.
Bye bye.